You're listening to Cyber 94 Podcast. If you want to break into cybersecurity with real-life experience, go to cyber94.com.
Dan, the headline we're looking at today is a tough one.
Mm.
And it's a perfect example of a risk that, most of us don't even know we're exposed to. The health tech giant TriZetto has revealed a data breach, and the numbers are just incredulous, staggering.
They really are, Ben. We're talking about the personal information of 3.4 million people. But honestly, the number of people, as huge as it isn't the part that made my jaw drop.
Right?
It's the timeline. Attackers were inside their systems, pulling data for nearly an entire year.
It's almost unbelievable. The breach started in November of one year and wasn't detected until October of the next. That is just a colossal failure of security monitoring.
Yeah.
It's like a thief quietly living in your house for 11 months and you never once notice something is amiss.
That's a great way to put it. And it's so important to understand who TriZetto is.
Right.
Because most of the 3.4 million people getting a scary notification letter in the mail have probably never even heard of them. You don't go to a TriZetto hospital for a checkup.
Exactly. They are what's known in the industry as a business associate. Essentially, they're a company that your hospital or your insurance provider hires to handle back-end processes.
Okay.
Think billing, processing claims, managing financial data. All the critical but invisible plumbing of the healthcare system.
So this is a classic supply chain attack. You trust your doctor with your data. Your doctor's office trusts a company like TriZetto to handle the administrative side. And that's where the weak link was.
Yeah.
It's a reminder that our data passes through so many hands we're not even aware of.
And the data that was taken. Chloe, can you break down what kind of information we're talking about here?
Yeah.
Because this is far from just an email and password leak.
This is the full kit for identity theft. The attackers got names, dates of birth, social security numbers, health insurance member numbers, the names of your providers.
Wow.
Basically a complete blueprint of your personal and medical identity. It's a goldmine for criminals.
The company did stress that financial information, so credit cards, bank accounts, was not affected. But let's be real, with a social security number and a date of birth, a criminal has everything they need to start opening new lines of credit in your name.
Exactly.
They don't need your Visa card number.
And that brings me to the part of these corporate statements that always feels so disingenuous. TriZetto said, "At this time, we are not aware of any identity theft or fraud." Well, of course you aren't. The data was just stolen. It's likely being bundled up for sale on the dark web as we speak. The actual fraud could begin months,
Right?
or even years from now.
It's a standard, legally vetted line designed to prevent panic.
Yeah.
But it offers false comfort. To their credit, they are offering free identity theft monitoring services through a company called Kroll. But this is a reactive measure, isn't it?
Oh, totally.
It's like giving someone a fire extinguisher after their house is already burned down.
It's the absolute least they can do. And we have to see this in a wider context.
Right.
This isn't just one company having a bad year. Cybersecurity reports show that attacks on the healthcare sector are surging. Criminals know this data is incredibly valuable and that the ecosystem is full of these third-party vendors, which can be a single point of failure for millions of patient records.
It really highlights this immense shared vulnerability. A breach at one company, OCHIN, a nonprofit, was one of the organizations that confirmed its patients were affected because they used TriZetto.
Wow.
A single crack in the foundation at TriZetto sent shockwaves that impacted patients in community clinics and rural providers.
So for those 3.4 million people who are now at risk, what does this all mean? Yes, absolutely sign up for the free credit monitoring, freeze your credit if you can.
Right.
But it also leaves you with this profound sense of helplessness. You did everything right, but your most sensitive information is now compromised
Because of a company you had no relationship with.
It fundamentally erodes trust in the whole system.
It truly does. It shows that securing the digital side of healthcare is just as important as the medical care itself.
Yeah.
The consequences of failure are just too high.
So here's a question we'd like you all to think about. When you give your data to a trusted entity like a hospital, how much responsibility do they have for the security practices of the other companies they hire to handle that data? Where does the buck really stop?